Hello, welcome to All Around Health Talk. If you haven't subscribed to our channel, you know what to do. Hit the subscribe button, put on your notifications so that you get notification for every time we post a video. Also, thumbs up, share our videos, leave us a comment or a question if you have something to say to us. Well, we're still on our tips series where we give you tips on how to manage your health in the best way possible. Today we're continuing with diabetes. So we're talking about ways to control your blood sugar level as a diabetic patient. Diabetic patients already have a high sugar level, and because of this high sugar level in the blood, they have a risk of suffering complications that will affect their eyes, their kidneys, their nervous systems, and their heart. And that is why it's important to control your blood sugar level as a diabetic patient. Now, what are the ways you can control your blood sugar level? Number one is diet. You have to avoid high glycemic index food. These foods are food that rapidly increase your blood sugar level once you consume them. We're talking about instant mashed potatoes. We're talking about baked white potatoes, instant rice, waffles, pancakes, cornflakes, Rice Krispies, dried figs, dates, sweetened drinks, bananas, pineapples. All of this can increase your sugar level very quickly. So you want to try to avoid this food. And yes, I know you're going to say, so what am I supposed to eat? We have a video. The next video is going to be totally on what you should eat as a diabetic patient. What you should eat, how you should eat them, what percentage, how to measure your food, what calories you're supposed to consume on a daily basis. So don't miss that video. Now, that is on diet. Number two way to control your blood sugar level is to know how to identify when you're suffering from hypoglycemia. Hypoglycemia is the opposite of your increased blood sugar level. It means that your blood sugar level drops really low for some reason. Now, how do you identify that? When you're having hypoglycemia, you're sweating, you're dizzy, you're tired, you're anxious, you're hungry, you're trembling. When you start feeling those symptoms as a diabetic patient, you know that you're suffering from hypoglycemia for some reason. Now, what should you do? In that case, you can actually consume the high glycemic index food, which we've mentioned. So as a diabetic patient, it is recommended for you to, when you go out with maybe a toffee in your bag, a banana, something that can increase your sugar level really quickly, so that just in case you experience a hypoglycemia somewhere, you know what to do. Now, apart from knowing how to identify hypoglycemia, how else should you control your sugar level? Exercising. Now, exercising doesn't mean that you have to go to the gym and lift up all the weight. You can do simple exercises like walking. Taking a walk for 30 minutes to 1 hour on a daily basis is good enough for you to burn enough fat and allow your cells to use up the glucose that your body has. Now, you can also do swimming, you can do jogging. Make sure you talk to your doctor to know what exercise is recommended for you. Now, what does exercise do for us? It also helps us to lose weight, because most people who suffer from type 2 diabetes have a high obese or overweight. And so when you're obese or overweight, your body becomes resistant to insulin, and that's why your sugar level goes high. So to help your body use up sugar and stop being resistant to insulin, you have to lose weight. And for that to happen, you need to exercise. Now, another way you should control your blood sugar level will be to check your glucose on a daily basis. You can buy one of these glucometers. They're not expensive. You would just have to learn to pierce yourself, take a blood sample, check your glucose level on a daily basis. If you don't know how to use a glucometer, we have a video from, I guess, a year or 2 years ago in our channel where you can learn how to use a glucometer. So that's important for you to see how you're responding to your medication and diet, and if there is any change, you can actually get help from your doctor by knowing the values of your blood sugar level on a daily basis. Another way to control your sugar level will be your medication. Now, some people require insulin. Type 1 diabetes always need insulin. People who have type 2 diabetes sometimes need insulin, but most times they are on tablets. Now, you would have to take your medications. Those medications will help you reduce your sugar level to a level that your body can tolerate. So make sure that you don't stop taking your medication for any reason. if you realize that your medication is almost about to finish, then make sure you buy new medications on time so that you're not left without medication. And please do not stop taking your medication for any reason. Now, last but not the least way to control your blood sugar level or take care of your health as a diabetic patient is to take care of your feet. Now, like we said, one of the complications of diabetes in a long run can be affecting your nervous system, which means that sometimes you might not be able to feel pain. Now, diabetic patients have a problem with healing. So when they have an injury, it takes a very long time for them to heal. Sometimes they have an injury and they do not realize they have an injury because they cannot feel pain. So pain is a very important sign. It tells us something is wrong, and it helps us to look for help on time. So as a diabetic patient, you always want to pay attention to your feet. Make sure that you cut your nails yourself with care and avoid hurting yourself. Or you can go to people who actually use very hygienic methods to cut your nails. Make sure that you always check your feet on a daily basis to make sure there are no injuries here and there. Avoid wearing tight shoes that can hurt your toes or your feet, and make sure that you wear shoes that are very good and very protective, so that you don't have an injury because maybe a nail pierced through the shoe and got to your feet. So make sure that you use the right type of shoe. Also, as a diabetic patient, you don't want to walk on barefoot because you might easily hurt yourself. And if you already have your nervous system affected, you would not feel any pain, and that injury is just going to keep getting worse until you actually have to go through an amputation of your feet or even your leg. So as a diabetic patient, this is what you need to do. Take care of your diet, exercise, pay attention to hypoglycemia, take your medication, check your glucose levels on a daily basis, and take care of your feet. If you have anything you do not understand or you want to ask any questions, remember, you can leave that for us in the comment section and we'll get back to you. And please don't miss our next video because we're talking everything food for the diabetic patient. You'll be surprised everything you can eat as a diabetic patient. There's this myth that you cannot eat this, you cannot eat that, but I'm going to be telling you that all of that is a lie in the next video. So make sure that you tune in to see the next video. Okay. Subscribe. Remember that. Subscribe, like, share, and leave us a comment. I'll see you in the next one. Bye-bye.